Let us start with anterior tibial artery. It is mainly supplying the blood supply to our anterior compartment muscles. Okay, so actually it's a continuation of popliteal artery. If you remember, the popliteal artery will be here. First is the femoral artery, right? After that popliteal artery. After that is this anterior tibial artery. So it is continuation of the anterior popliteal artery, and this is a smaller terminal branch of popliteal artery. So it is course as it begins on the back of the leg at lower border of popliteus opposite to tibial tuberosity. Okay, and it enters anterior compartment of leg by passing forward close to the fibula. I can say this is the fibula, this is the tibia side. So close to the fibula it will pass forward and through an inner in the especially in the upper one third of the leg. The artery lies between the tibialis anterior muscle and extensor digitorum longus. I'll show you the another diagram to see that. So actually you can see here this anterior tibial artery only on the dorsum of the foot. It will convert into dorsalis pedis artery. So first femoral artery, next the popliteal artery, next the anterior tibial artery, next the dorsalis pedis artery in the dorsum of the foot. Okay, so now let us see its relations with the muscles. So if you see especially in the upper part, this artery is between the tibialis anterior and extensor digitorum longus muscle. So okay, this is the tibialis anterior muscle, and you can see here it's mentioned extensor digitorum longus. So at the upper part it is between these two muscles. Okay, and in the middle one third it is between the tibialis anterior muscle and it is between the extensor hallucis longus. You can see here it's mentioned this is the extensor hallucis longus. So the upper part between the tibialis anterior and extensor digitorum longus, but in the middle part it is between tibialis anterior and extensor hallucis longus. Okay, coming to the lower part, it is between the extensor hallucis longus and extensor digitorum. If you see here, this is the extensor hallucis longus and this is the extensor digitorum longus, this side. Okay, so in the lower part exactly here you can see it is between the extensor digitorum longus and extensor hallucis longus. Okay, so in understanding these relations, note that the artery is crossed from lateral side to the medial side mainly by tendon of extensor hallucis longus. Yeah, if you see extensor hallucis longus, it is moving from the lateral side to the medial side. Okay, the artery is accompanied by two vena comitants. The deep peroneal nerve is lateral to it in the upper part. So you can see here the common peroneal nerve, in turn it will divide into deep peroneal nerve. So if you see the deep peroneal nerve, it is lateral in the upper part and also in the lower thirds it is lateral, and anterior to it in the middle one third. So in the middle one third it is anterior, but upper and lower parts it is lateral. You can see this is the artery, this is lateral to it, you have the deep peroneal nerve. So now let us see the variations that the anterior tibial artery may be partially or completely replaced by perforating branch of peroneal artery and by perforating branches of posterior tibial artery. Okay, they may be replaced either by posterior tibial artery or peroneal artery. Let us understand their branches. So it is having a muscular branches. Of course it will supply all these muscles of anterior compartment like tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. So all these anterior compartment muscles of course are supplied by the muscular branches of this anterior tibial artery. And it also gives some anastomotic branches which are mainly given to knee and ankle joint, and also it gives, I'll show that diagram there. So you can see here these are the different branches. Actually it gives mainly the anterior and posterior tibial recurrent arteries. So this is anterior tibial artery, right? This is a posterior tibial artery, and it also gives some recurrent branches like which are going upward. Okay, and right, and they take part in anastomosis around knee joint, and anterior medial malleolar and anterior lateral malleolar branches are also given. You can see here like anterior medial malleolar, anterior lateral malleolar, this one. Okay, so like that it will also give anterior medial malleolar here, this one. This artery is the anterior medial malleolar artery, and here this is the anterior lateral malleolar artery. So these are also given which take part in anastomosis around the ankle joint or malleolar networks. You can see here around the ankle and malleolar networks. Next, coming to lateral malleolar network. If you see here, this is called as lateral malleolar network. It is lying just below the lateral malleosus muscle. It is bone. It is formed mainly by anterior lateral malleolar branch, okay, of anterior tibial artery, and also by lateral tarsal branches of dorsalis pedis artery. You can see lateral tarsal artery of dorsalis pedis artery, right? And also it is formed by perforating branch of peroneal artery. So perforating branch of peroneal artery will also take part here. This one is a perforating branch of peroneal artery. And next you also have your calcaneal or terminal branch of peroneal artery. So there is also this one, calcaneal branch of peroneal artery. Okay, and there are also twigs from lateral plantar artery. So this is a lateral plantar artery. So these are all forming the lateral malleolar network. Once again, let us revise what are all present here. So let us zoom it somewhat. So first here you can see this is an anterior lateral malleolar artery. Okay, this is coming from anterior tibial artery, right? So anterior lateral malleolar artery, and anterior lateral malleolar artery is coming from anterior tibial artery. You know, anterior tibial artery only will convert into dorsalis pedis artery in the dorsum of foot. So from the dorsalis pedis artery we are getting a lateral tarsal artery. So lateral tarsal artery, anterior lateral malleolar artery, and a lateral plantar artery, and a calcaneal branch of peroneal artery. So all these are forming a network around the lateral malleosus. Of course, we have forgot the perforating branch of peroneal artery. So from peroneal artery you are getting a calcaneal branch, perforating branch, and you are getting one lateral plantar artery, one lateral dorsal artery from dorsalis pedis artery, and of course anterior lateral malleolar artery. So all this are forming a network around the lateral malleosus, and this is called as lateral malleolar network. Now let us move on to the medial malleolar network. This is lying just below the medial malleosus, and it is formed by anterior medial malleolar artery. You can see here anterior medial malleolar artery, of course, which is coming from anterior tibial artery, right? And next you have medial tarsal branches of dorsalis pedis artery. So medial tarsal artery from dorsalis pedis, of course. And next you are having the medial malleolar branches of dorsalis pedis of posterior tibial artery. We are getting one more artery, that is what is it? Medial malleolar branch of posterior tibial artery. Medial malleolar branch. So medial malleolar, this one, posterior tibial artery, it will give one medial malleolar artery, this one. From this, and there is also calcaneus branch of posterior tibial artery, this one. And there is twigs from medial plantar artery. So they all together form the network around the medial malleosus, that is called medial malleolar network. So once again, let us revise what are present here. First, of course, are anterior medial malleolar artery, which is coming from anterior tibial artery. It is containing forward as dorsalis pedis. Dorsalis pedis will give one branch, that is medial tarsal artery, and of course you will have one medial plantar artery from the lateral plantar artery, and you will have a calcaneal artery. So this is a posterior tibial artery, right? So from the posterior tibial artery you will get this medial malleolar artery, you will get this calcaneal artery, you will get this medial plantar artery, and also lateral plantar artery. So but remember, only medial plantar artery will take place in this anastomosis. So this is called medial malleolar network of arteries. So all these networks are forming around the lateral and medial malleosus. Okay, so by this we completed about our anterior tibial artery. Next we'll discuss about the deep peroneal nerve.